Hello, my name is Christophe Bourdon. On behalf of Amgen Oncology, I am truly honored today to introduce Maimah Carmo. Mema was diagnosed with stage 2 triple-negative breast cancer when she was only 32 years old. And while undergoing chemotherapy, she started the Tiger Lily Foundation, a national organization that provides breast health education, empowerment, advocacy, support, and transformational programs for young women, with a focus on ending disparities for young women of color. And this is an important cause, one made even more urgent because of the COVID-19 pandemic. So we, at Amgen Oncology, would like to thank Mema and her team at Tiger Lily Foundation for the crucial work that they do. Please join me as we listen to Mema's important message today, and please join her in taking the Inclusion Pledge.
Thanks, Christophe, for the wonderful introduction. And thank you so much to Amgen for inviting me here today to speak with all of you. My name is Maimah Carmo. I'm a first-generation immigrant and a 14-year survivor of breast cancer, a sole purpose love warrior, and a justice seeker. Since I was a child, I've known that I was born to live a life of service and compassion. In 1989, when I was 15 years old, I came to the U.S. after fleeing a war in my home country of Liberia, and I'd seen things that, frankly, no child should ever see. I'd also seen the power and beauty of compassion as I watched my mother, who was a nurse, train women from all over the country to become health workers. My mother, when I was 13 years old, ever a nurse, showed me how to do a breast self-exam. She taught me the importance of knowing my body and to speak up if something came out or looked wrong. 14 years ago, in the fall of 2005, I found a lump in my breast while taking a shower. I went and saw my OBGYN, who sent me to see a surgeon and to get a mammogram. The mammogram came back clean, and the doctor told me that I was too young to have breast cancer and to go and live my life, and to come back in 6 months or a year, or when I was 40. I had to push for 6 months to get a biopsy. And then, on February 28, 2006, at 4:45 p.m., I learned I had stage 2B triple-negative breast cancer. I had no family history, and I was only 32 years old. Triple-negative breast cancer is one of the most aggressive types of breast cancer for which there was no targeted treatment at the time, and no effective diagnostic tool beyond a biopsy. How many other women my age were being told by their doctors that they were okay, or to wait? If I'd waited, I'd be dead today. One night laying in bed, feverish, nauseated, and drained, just tired of being tired, I began to map out what would later on become Tiger Lily Foundation. Our mission is to educate, advocate for, empower, and support young women before, during, and after breast cancer. Women come to us worried, afraid, and we turn them into warriors. We help women from all backgrounds, those who are at heightened risk, those facing health disparities, and those with less access to care. As I grew in my advocacy and along the path of discovery, I learned that Black women have a higher incidence of breast cancer at younger ages and more aggressive breast cancers. Black women are often diagnosed with cancer at later stages. Due to systemic racism and biases, Black women face multiple barriers to care. Barriers like lack of access to the best cancer centers, cultural barriers, and, honestly, discrimination. Due to medical mistrust and abuse and experimentation on Black people, there is little or no trust in the healthcare system. For Black women, clinical trial engagement is less than 5%. We are absent in all but the statistics. And COVID-19 has made these worse and exacerbated all these existing barriers and health inequities. When I attend conferences, I see people in the healthcare system, scientists, researchers, talking about disparities and the critical needs of the community. But I've rarely seen them ask someone like me, a Black woman, what we need. Nor have I seen women who look like me at these tables. To stand here and speak to you today, I feel seen. I feel change is possible. Tiger Lily is able to provide patients with financial assistance, and we're pushing people to become their own best advocates, stronger, more empowered, and more in control of their health. With partners like you in biotech and pharma, we're working to pinpoint where the deepest needs are, to work to build patient trust and engagement, and ensure people are getting screened and getting patients screened safely, We're committed to ensuring that these difficult times evolve all of us to become more resilient. While we've seen disparities amplified by COVID, Tiger Lily is here working to ensure that we meet these needs and these challenges head on to address and eliminate barriers once and for all. I know what it's like to fight. I've survived 2 civil wars and international conflict. I've had to fight for my family and fight for my life. I know this battle is winnable, but it needs and will take all of us. The Tiger Lily Inclusion Pledge provides a transparent and tangible framework across stakeholder sections, which identifies and tracks equity actions, holding people accountable who by either action or inaction contribute to the loss of life for people of color. I always say race, literacy, financial barriers, access, social, systemic, and hereditary background should not be determinants of life and health equity. Our Inclusion Pledge is a rallying cry and a catalyst for change that will unite organizations all around the world to dismantle systemic barriers to care. It's incumbent on us all, and those in particular who have privilege that allows for the oppression of others, to use that privilege to end discrimination once and for all. As Dr. King said, what affects one affects all. I cannot be who I ought to be if you are not who you ought to be. That is the interrelation of reality. Our humanity is the one thing that strips away our color. In the middle of this crisis, we have to act to create a better world. Think about what change you can make today. Devote your time, devote your love, devote your capital, your soul, and energy to work towards that. Take the Inclusion Pledge today. Thank you.